Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a laboratory inquiry. This audio podcast as part of a Helm and BackRow. This audio podcast as part of a Helm and Rudder. This audio podcast as part of a Storm and Robotics production. In this audio podcast, now delving into the themes, the themes sort of linked to nephrologists and or clinicians as part of this peer-reviewed and published works from 2023. So, understanding of chronic kidney disease and perception of kidney care. So, I suppose one thing about knowing about the numbers and understanding them is that if we're over reliant on the numbers, then over reliant on the numbers, then we might feel falsely reassured. We might be falsely reassured. For instance, we might falsely reassure. For instance, I do not know whether that's an enormous gap. I think part of the understanding of blood results is that it's part of a bigger thing, which is taking control of illness and understanding its treatment and being a partner in your own care. So I think it's an important part of that, but I don't know whether understanding adequately is a big gap, to be honest. And that was from one of the clinicians in around the ICA around this. Nephrologist perception informs there should be a link between sort of healthcare service users sort of level of understanding and sort of in line to in line to the healthcare service user level of understanding, and also in regard to self care, in around self care, or self in around self care. And in regard to another theme, education through technology and digital healthcare. So could look on the internet in various ways, and they can use patient support, as they often do, and they can do all sorts of online investigating. And those people who use online forums, here the healthcare service users have access to fellow renal patients, fellow renal healthcare service users, so they can. I think that's got a role in finding. I think that's got a role in finding things out. uh, and one clinician or nephrologist informs. So in around the ICA, and in around the ICA. So understanding highlights the importance of peer support for CKD healthcare service users in terms of providing education and healthcare service user support. So now, in regard to another theme is health literacy, health literacy and professionalism. So now, I suppose some people might argue that information is given in such a raw form, as to be too complicated to understand for many healthcare service users or patients, or that you might say that many patients or healthcare service users might not have the ability to understand that information. So in around the ICA, around this, understanding informs that the importance of acknowledging patients or healthcare service user health literacy levels, and need to provide uh, sorry and I need to provide education that is accessible to all. Now, in regard to another theme looking at future roles of allied health care professionals. So the this theme was a theme, or where in around the topic guide, questions were informed in a way, and asked amongst clinicians and nephrologists, as part of this works as part of this works. And so the data informs of the following, or the data collection informs of the following, in regards to the nephrologist and the nephrologist, or clinicians' perspective on this. So I mean we get a lot of phone calls from general practitioners or GPs, and sometimes we feel that they don't all necessarily need to come through us, but we're usually available. We're usually available, and the registrars are usually available at the end of the phone, and that's where they go, that's where they go. And sometimes you think, yes, they could potentially have other access that would be able to answer. I think that would be a good that would be good actually, and that would be brilliant. Informs one of the clinicians and nephrologists as part of this works. So in regard to the ICA around this, so nephrologists understanding, or clinicians understanding, inform a requirement for CKD healthcare service users to have specialist input in helping interpret and understand medical context. Research has also several areas where future roles for professionals should develop best practice. So that draws this audio podcast to a close. The subsequent audio podcast will go into the themes in regard and relating to the healthcare service users and CKD patients. So that draws this audio podcast to a close. This audio podcast is part of a Helm and BackRow. This audio podcast as part of a Helm and Rudder. This audio podcast as part of a Storm Robotics production.